The Midwives Association of Guyana, in collaboration with the Ministry of Public Health, held a one-day training session for midwives to manage postpartum bleeding, or bleeding after childbirth. This type of bleeding leads to one-third of all maternal deaths and is preventable. But the Deputy Chief Nursing Officer, Nalini Das Sutton, pointed out that the problem persists.
We have had our share of maternal deaths over the years. The year 2019 is no different. We are also aware that some deaths were avoidable and some were not.
The training session represented continuous training for midwives from all 10 regions of the country, and it is the hope that they will pass on the information to midwives in their regions. One of the facilitators of the program was Dr. Narain Singh, who identified postpartum hemorrhage as a major problem.
About one-third of our maternal deaths are due to postpartum hemorrhage. And the thing is about it, it's preventable. So you just need the skills and how we can be part and get them to practice do the right practices. We know that doctors are important in managing patients, but the nurses and midwives are also integral part of the management of a maternal patient. And so they play a very important role, and so they need to get the relevant skills, just like the doctors, to be able to deal with these complications when they arise.
Dr. Singh noted that 95% of deliveries are done by nurses and midwives, with doctors only stepping in when there are major complications.
We're hoping that with these sessions that more and more nurses will be educated, come up to date with what is the evidence-based practice, and so that we can see a reduction in this problem of postpartum hemorrhage. It's something that we can deal with, but we're hoping that more and more nurses getting educated and being brought up to date, that we can see a reducing incidence of postpartum hemorrhage.
Midwifery advisor Mandy LaFleur noted that the training was intended to train midwives in the competencies of their job and sought to expand on what that means.
And when we talk about competencies, we're talking about their knowledge, we're talking about their skills, as well as their attitudes. Because we can have knowledge, we can have skills, and if we don't have the attitude, then we are not competent. So the Midwives Association is working to strengthen those competencies in all regions of Guyana.
Since its implementation, reports show that the Zero Maternal Training Program led to a 33% reduction in maternal deaths by hemorrhage. Figures for this year are not available, but the authorities have reported an increase this year with early bleeding in pregnant women. Reporting for Newsroom, Esenela Patwa.